So actually, let me just put the camera up while I speak. So I would verify my doctor's order just to make sure just to see what type of wound I'd be doing as well, dressing I'd be doing as well as the type of solution that is needed. Once I verify my doctor's order, I would perform hand hygiene, enter my patient's room, and introduce myself. I would identify the patient using 2 patient identifiers. I would explain the procedure and obtain consent. Once consent is obtained from my patient, I can go and gather my supplies. So for the purposes of this dressing change, we would need a pair of sterile gloves, some Q-tips, a measuring tape, some extra 4x4 gauze, some steri-strips, and a sterile tray, as well as my normal saline solution. So once I've gathered all my supplies, I would perform hand hygiene and enter my room again. I would put the patient in appropriate work, in a comfortable position. I would put the bed to appropriate working height and just keep in mind proper ergonomics. So I would put the bed up to about waist level. I would put the opposite rails up, just make sure the call bell is in reach just in case we do need it. I would have my side table all cleaned off and cleared. All the personal belongings for the patient off of it, cleanse the table with Clorox wipes, and then I'm just going to tilt my camera down so that you can see my working station for when I'm opening my sterile trays and stuff. So again, this is my patient right here, here's my wound, and then this is my side table. So I would be working from my side table, cleaning my wound, and then I would set up my garbage right here. I would use the actual garbage in the room, or if I wanted to use the garbage that comes into the packages, I can just set it up on the bed. So I would perform hand hygiene and don clean gloves. Once I have clean gloves, my patient's in a comfortable position, I would remove the dressing and I would be taking note of the dressing. So whether the type of drainage that I have, whether it's sanguous, steri-sanguous, or purulent fluid, as well as if the dressing is saturated and the amount of drainage that there is. Once I've done that, I could go ahead and throw away my garbage that I have set up here. I would then take note of the wound. So I'm looking at everything that can help me paint a picture later on for my documentation, just so that we can track the progress and see if it's improving or not. So I'd be checking for any granulation tissue and the percentage, any neurotic tissue, again, and the percentage, check the edges of the wound, if it's proximal, if it's healing nicely, or any inflammation, any redness, just any kind of sign, any odor that shows me as a sign of infection. So once I've made note of my wound, note of my drainage, I would then measure my wound. So this is clean. My wound is considered dirty, but still I don't want to introduce any, I don't want to introduce, pretend that didn't fall. If it did fall, I'll just go and get another one, but it's clean, so I don't want to, I have to make sure not to touch the wound, or so I'm not introducing any foreign objects into it. So just approximately just measuring it. So we'll be measuring the length, and this is approximately 5 centimeters in length. I would also be measuring the width. So this is about 2 centimeters from the widest edges. Once that, I'll just make note of that numbers for later on for my charting. I can just place that aside because I'm going to need it later. Once I'm done with all of that, I can doff my clean gloves and perform hand hygiene, and then we can go ahead and start setting up our sterile field here. Okay, so I would open my tray. I can take this right off and I can place it in my garbage. I can touch this edge of the forceps because it's considered clean, and then I would remove my sterile field, making sure to only touch the 1-inch border with my hands, and just allowing it to open on its own and placing the shiny side down. Sorry, my working area is a little bit weird, so I'm just gonna pull this back here, and again I can touch the 1-inch border just to move this down, and then I can proceed with removing the other parts of my dressing. So this is another extension of my sterile field. I do not need it right now, so I can just place it in the middle. And I want to be careful that when I'm placing things in my sterile field that I'm dropping it directly in the middle, because I do not want it to compromise touching the 1-inch border. I can remove my garbage. This is an additional garbage that usually comes packaged, but once you remove this can be clean and you can set it up on the bed. For right now, I won't be using it, so I'll just place it in the garbage. I can go ahead and remove my forceps and the gauze, placing them in the middle, making sure not to drop my hands below my waist. If this was a proper side table, I'd be able to lift it a little higher. So when I'm placing my forceps down, I want to make sure that the tip of my forceps is well beyond the 1-inch border so that it doesn't compromise the sterility. As well as, in a perfect world, I would not be reaching over my sterile field because that does compromise it. We're gonna go ahead and start opening the other additional stuff, like my Q-tips. So then I would use this. So I'm just gonna move this over there and just remove and add it to my sterile field. And then I can just toss that, and then I can place that again like that. So now I'm adding my steri-strips to my field. Just place it there. So you can also open it out and drop it like that. It's just, you need to be careful because the flaps can compromise or touch things accidentally. So I think the safest way is to use a forceps for myself. That's what I prefer. You have more stability and more control. And then I can toss that. I would open some extra 4x4s, and again, you can peel it back like a banana, hold the flaps, and either drop it on or use your forceps to remove them. Okay, and then I would toss that in the garbage. So once I have my sterile field all set up, sorry, everything removed from my sterile field, actually I would check my solution, the date, the time, the last time it was opened, just to make sure that it's still you're still safe to use. When I'm pouring my solution, I would cover my label and make sure not to go over my sterile field. So I would go around. Oh, you can't see. Again, I wouldn't be reaching over anything, and just pour from this side so my solution isn't over anything, so I don't risk compromising any drops onto my sterile field, because once the sterile field is wet, it's considered compromised and you have to start over again. Plus you wouldn't want to waste resources for unnecessary reasons. So I add some extra, so I've added some solutions to my cotton balls, as well as on the other side, just so that later on when I'm gonna drench my steri-strips into that for packing later on. So once I have everything all set up, I would clean my hands. And if I haven't already said this, normally prior to opening after I've done assessing my wound and getting rid of the drainage, I would doff my clean gloves, I would perform hand hygiene, and then I would use my clean hands to set up my trays and my forceps. And once that's all done, everything's all set up, I would perform hand hygiene again, and then we would proceed with putting on our sterile gloves. So normally I would go at the edge of the table here to put my tray on, making sure not to turn my back to my sterile field, so I still have view of my sterile field over here. This would be my side table, and I'll just use the edge right here so that I could put my sterile gloves on. I'm just gonna go ahead and turn that around so I have a little bit more room. I would don my non-dominant hand first, and it's okay to touch this inside part because it's not sterile. It's going to be clean because it'll be towards your hand, and then I can scoop my hand in here, making sure not to touch the outside and only touching sterile with sterile, and then we can go and put the clean gloves on. Once that's done, I can adjust this hand. I can touch the middle, the center of this, and just toss that there into the garbage. So I'm just gonna adjust my camera so that you guys can see the packing of the wound. Again, in a perfect world, I would not be doing this because I wouldn't want to compromise the integrity of my sterile gloves. Again, I would not drop my hands below the waist at all. So now I have my working station, I have my patient here. If I needed to adjust this tray, I can touch the inside of the tray like that, and I would not go over my field, I would go around. So I would just want this to be right here, so that when I'm touching my wet solution, that it isn't going over my sterile field, because I don't want anything to drop onto my sterile field. So now that my hands are clean, I can go ahead and grab my forceps and we can start cleaning the wound. So we clean from clean to dirty, so I can go and just wring out any excess solution. I would clean the center of my wound and then toss that into the garbage, making sure not to drop my hands. And I would clean distal away from the wound, so furthest from me. Then I would clean proximal to the wound and toss that into the garbage. And then I would clean in that same order. So clean, center, drop. And I like to just ball it up in a little ball, and then clean away from me, drop. And then clean closest to me and drop. Whoops. Now that my wound is all clean, I can, if I need to put my forceps down, I could just place them and make sure the tips are well within the 1 inch corner, so that they're not compromised, just in case I do need to use them again. I'm gonna go ahead and drop my steri-strip into the extra solution. You can wheel it out if you may, and then you can take the Q-tip. And now that my wound is all clean, I can just dip it in, just so I can have an idea of how deep the wound is, and then make sure not to touch the edge of the wound or the outside at all. And then once I have that, I kind of just make note of it with my eye, and then once I have it, then I can just snap it so that I can measure it later on, and just keep that off to the side. So my wound is now clean, so I'm going to go ahead with packing the wound. So I'm going to bring out any excessive solution, and then I'm just going to be using my hand and kind of making sure that my steri-strip isn't touching or being compromised. So I'm just feeding it into the wound using I can use my other stick just to make sure that my hand isn't touching the wound, because if my hand touches the wound, it's no longer sterile, it's now going to be clean. So, and I just use the zigzag method, using my Q-tip to hold one end as I just zigzag it in, making sure I have proper control and not losing control of this of this steri-strip and having it fly all over the place and compromise the sterility of it. And I could just continue to do this until my wound is all tightly packed. Using the zigzag method, using the Q-tip to hold it in place as I do the other side. I would also make sure that if I run out of the steri-strip and I needed more, I would call a colleague to come and bring me some and do the same technique to maintain sterility and to get it moist and add it in. I can either tie it to the tip of this one, or I can leave 2 tails and make sure that I document it so that the next person that removes it knows that there is 2 that's in there that's going to be removed, as well as so they can bring 2. So once I'm all done with my, so I remove this over here so that you can see, then I'm going to leave a little tail out so that for when they're going to remove the dressing, they have that to pull on. You want to make sure it's packed in there nice and neat. I can now get rid of my syringe. Normally I would not do this, but I just want to show you how it's nicely packed and the little tail that's there. So now that I have that all done, my gloves would normally be still sterile because I'm not touching anything there. I can take my 4x4 and just place it over. If I had an abdominal pad, with the same manner that I removed the extra stuff in the package, I would add it to my Sterile Field, and I would then take it and place it over my dressing. Now that everything is all good with my dressing, my abdominal pad is covering it, I would take my tape and tape around the edges of my border just to secure the dressing, and then I would doff my clean gloves. You might want to doff your clean gloves prior to taping it. Once the dressing abdominal pad is over it, it's okay. You perform hand hygiene, so I could sign it, date it, put the time that it was done, and then I can put the patient in an appropriate, comfortable position with a call bell within reach. See if there's anything that they need prior to leaving them. The bed back down, the appropriate bed rails up. I would discard of my supplies appropriately, so the metal forceps and the sharps, anything with bodily fluids and biohazard, everything else can go into the garbage. My patient's not comfortable. I would then go and document. I would make sure I document the color of the drainage I saw, the amount that I saw, and just paint a perfect picture with descriptive words of the wound, so granulation tissue, the percentage, any neurotic tissue, and then just like the edges and all the information to paint a proper picture for them, date it, sign it, and then we're done.